Millions of Americans have received their COVID-19 vaccines, but there are still many others who have not, and convincing them to change their mind is not an easy task. Dr. Adam London is the Administrative Health Officer at the Kent County Health Department. We've been talking with him since the pandemic began. And first, I just want to ask, is there a place where you're seeing the most resistance from different neighborhoods, different people? Where are you seeing that resistance?
Well, thanks, Val, for talking about this important topic with us. Right now, we're seeing the lower vaccine coverage rates in Kent County, both in our urban core areas and in some of the rural outlying areas around the county. And we think there's probably some different reasons for their hesitancy. But we really want to see these areas rise up to the level that we're seeing across the rest of the county, which is very good. In fact, in some places in Kent County, we're seeing over 80%.
Wow, that's wonderful.
Yeah, we're really good in a lot of places.
What is the reason that most people give for not wanting to get vaccinated? I know a lot of them say, it's just too new. What do you say to those people?
Well, for those who think it's new, it is true that these particular vaccines last year were developed in record speed, and it was really a huge victory for technology and science. However, the science and the research of coronavirus vaccines is about 15 years old. So there was a lot of work that had already been done looking at SARS and MERS and other similar viruses. So we were already pretty far along when this one arrived. So the safety and the integrity of these vaccines is very, very high, and we're very confident in them as great tools to stop this pandemic.
I know some of the reasons too is the fact that they thought it was developed too fast. But that technology in trying to develop vaccines at a faster rate has also been in progress for quite some time.
Yeah, that's true. And that's really part of our national safety and security, that we have the sort of pharmaceutical technology and the right industries and science in place so that when things like this do emerge, we can respond to it as quickly as possible to make sure we have safe and effective vaccines available for this. And that's exactly what happened last year, a tremendous accomplishment.
Right now, Michigan is about 59% of Kent County residents having received at least one dose. So how realistic is it that we can expect Kent County to get to the point where the president wants us to be at 70% by 4th of July?
Well, so the good news is just on the last day, we crossed that 60% threshold. So we're making great progress. However, I do think it's a long shot that we're at 70% by the 4th of July. However, I do think it's possible that we get there. But to make that happen, we really need people to encourage those who haven't been vaccinated to please do that. Right now, the biggest reason for those who are hesitant isn't that they have some big concern about safety. It's just that they haven't found time to make it a priority in their lives yet. So we're really encouraging those people to make it a priority. Let's get independence from coronavirus by the 4th of July.
I know we've seen a lot of PSAs running, encouraging people to get vaccinated, reminding them to get vaccinated. We've been making clinics more available where they live, hopefully a little bit closer to them. But do you think you have to even come up with newer initiatives like going door to door, going into neighborhoods?
I do. And we're working on that right now to kind of, and the description I've used for my team is follow the ice cream truck model, where we're in the community, we're very present, we're removing as many barriers, transportation and registration as possible to get vaccine available to them, and putting it in places where they're already going, whether it's the pharmacy, maybe their church or their school, to make it very, very accessible to people where they're already at.
Is there anything else that you want to say when it comes to really trying to reach that 70% goal by 4th of July?
Yeah, so we know based on our surveying that 70% of the population is willing to get vaccinated. We just have that last 10% of people who are willing, but they just haven't been highly motivated to go and pursue it. We know it's an inconvenience. We know people don't like shots and they have their reasons, but please, for the sake of those who are still the most vulnerable, for the sake of those who can get vaccinated, please get it done. It is safe and effective, and we need to get there for the sake of our community moving forward.
Thank you for your availability, Dr. London. I appreciate you talking with us about this topic. Of course, if you would like to find out where you can get vaccinated, I've got information for you on 13onyourside.com.